non-affirming language grows out of and reflects negative attitudes.
Absolutely, yes.
And we come up with more affirming language to try and get away from that, particularly because of the impact on people of that negative language.
Yes.
We're interrogating language, and we're moving, and we're trying to invent new terminology as we go that better captures and conveys to autistic people that their experience is being better captured, and that you have some sense of their world, not that you just know how to tick the box of neuroaffirming language.
We'll launch in then, shall we?
Yeah, so we're talking about neuroaffirming language, right? And it kind of follows on from what we were talking about last week, because we were talking about one of the kind of areas of the opposite of neuroaffirming language, that, you know, people don't find some of that kind of high functioning, low functioning language neuroaffirming. They find it the opposite. So it is interesting to look at other examples, but also what's the neuroaffirming alternatives, you know, like what's being recommended to people. I did have one general thought, if that's okay, just to
sure, yeah.
I was thinking about the whole area of neuroaffirming language and how it fits historically into this larger territory of other types of affirming language, like gender affirming, or, you know, like, you know, I mean, in the sense of, you know, various, you know, gender identities that, you know, might not be the one that people were assigned at birth. That whole territory, you know, LGBTQ plus affirming language, queer affirming language, but also just gender affirming in the sense of female affirming, you know, the ways that you know, more so can, you know, in what is still somewhat of an unfortunately patriarchal society, you know, women affirming or unaffirming language, and so on, in relation to various minorities, disability affirming, disability not affirming. That, you know, I was thinking about that whole territory, and also then neuro-affirming or non-affirming. I was thinking that, you know, the non-affirming language grows out of and reflects negative attitudes.
Absolutely, yes.
And we come up with more affirming language to try and get away from that, particularly because of the impact on people of that negative language.
Yes.
And some people, I think ourselves, for instance, included, when we learn about that affirming language in any area of human life, neuroaffirming, gender affirming, or color affirming, you know, we think, oh, yeah, I see what you mean. That old language doesn't actually reflect my real attitude. So I'm glad you've told me, and, you know, I'll shift to the new language, because actually, yes, that does actually, I think my real attitudes are better reflected by that. But then, you know, a lot of people, they don't want to change their attitude, actually. So they might use the language and they might not, but language change doesn't automatically change attitudes.
No, because someone can do it as a tick box of being politically correct.
They can do it kind of resentfully, reluctantly, or almost sarcastically, or, you know, so that point struck me that really what we want to change is attitude. Now, language can change attitudes. Language change can in turn affect attitudes, though often in the later generations, you know. So I just thought, because we were going to talk more about neuroaffirming language, just that point struck me, that it's language, and it's about changing language, but ultimately what we want is the attitude change to reflect that language.
Absolutely, yeah, so that people can be their authentic autistic selves without shame. You know, if it's used in a way that suits autistic people, that autistic people are saying, yeah, this is respectful, this is validating.
Yes.
You know, and as you say, with then being introduced to new terms for all minority groups, new to a person, like if I hear a word and I think, oh, right, I see, it makes me think about what language I'm using for that group of people and why I might be using that and what I actually believe. So it helps you to access the unconscious biases, and prejudices, actually, if you want to do that work.
Yeah, that's it. If you want to do that work, and obviously it can be work for any of us. It doesn't necessarily just a simple change, and there's change over time. I mean, I think in the time we've been working together, and being involved in this whole area of neurodiversity and neurodivergence. There's already been questions and changes, like the word neurodivergence, for instance. Not everybody likes it. Disability is a word that some people are happy to make use of in describing their experience of being neurodivergent. Others not. Partly maybe depending on the particular connotations or how it's being used or the context. Like accommodations, for instance, in a place like work. In work settings. I mean, I've heard some people, just very happy with, useful term, let's look for accommodations. Other people saying, something not quite right about the term accommodation, the wrong ring to it. We want to move on beyond that to something else, and so fine, that's great. We should be working all the time to just get the best and the most useful and the most empowering and respectful, as you say, language. Yeah.
And weed out those prejudices that are unconsciously growing there. Yeah, absolutely. We all have to be doing that, don't we, all the time?
I mean, I would have initially, when I got involved in this area, I would have automatically used the term comorbid conditions because it's the common word, because it's the word that's often used in the field of therapy, not always. But yes, as soon as somebody pointed out that if you use the term morbid, you're referring to a disorder. You're assuming that there's something wrong. So if two things are comorbid, like, two physical illnesses, for instance, if somebody might being comorbid, you're saying they are both illnesses. They are both disorders. They are both things that need treatment. Whereas, if we're saying that, well, autism and ADHD aren't the experience of being autistic is not a disorder. Well, then nothing can be comorbid with it,
or even co-occurring as a condition. Because being a human being, being an autistic human being, that what can co-occur as a condition of being a human being.
Yeah. So I think co-occurring is certainly the term that's most seen as the most affirmative and neuroaffirming these days. But again, even terms like conditions, it's like, again, depending partly maybe on what they mean to people and the connotations they take on, like words can be acceptable at one stage and then not acceptable at another stage.
But you might think you're being kind by saying, someone's suffering from or needing treatment for, but these are ways in which you're saying that there's only one healthy and normal. And that people must be suffering from not being healthy and normal if they're different.
That's right. Yeah. Treatments and interventions and things like that, are not neuroaffirming language. Support is neuroaffirming, generally seen as. And interesting word, therapy, though, when you think about it, because therapy is generally seen as a respectful word, and that we feel
well, we're going down a rabbit hole now, aren't we?
yeah, exactly. We feel we need therapy, but and then there's the word counseling, and there's nobody's ever been able to make clear differences that everyone agrees on between those, even outside of the world of neurodivergence. But some people would point out, and I can see why, that therapy in some ways is not all that different from treatment. Therapy also implies there's something wrong that we're going to fix, whereas maybe counseling doesn't, So it is, language is so important. It's just important, and we just have to stay aware and stay sharp and stay open to learning, I think, and stay aware of the individual's needs, because in the end of it all, individuals may find different things affirming or non-affirming, different words.
Yeah, self-definition is important, isn't it? Yeah, not being defined by others, but actually if a person were to say, no, I want to say that I am a person with autism, and they are an autistic person, and that's up to them, and they are entitled to say that, and that's their preference, that's their comfort level, that's what they, resonate with.
Yeah.
But in the autistic community, as I understand it, most people are saying that we are autistic because it's not something that's separate from us. It's not something that we have. It's something that we are, like the writing through the stick of rock.
That's right. Yeah. And it is. It's a strange one, that, because, it has been, that person first language has been widely used for a long time in the world of disability. Less so in the UK and more so in America, according to what I was just reading recently in quite a recent book about disability studies. But still, it's in the English speaking world in general, there's been strong, well meant, I think, emphasis on person first language. But in the world of autistic people, it doesn't seem to be generally welcome. And most people, I think, would say that for them, saying, man with autism rather than autistic man will be like saying man with Irishness, rather than Irish man.
Yeah, or woman with gayness.
Yeah, exactly, rather than gay woman, So I think that is the way that the trend has definitely gone. And when you think of it that way, it does seem just more simple and accepting, in a sense. Yeah, just more deeply accepting, which is, it's like the tortuous language sometimes that gets used. I do think, and I'm not the first one to say this, it's not just my idea, but is that, it actually sometimes reflects the fact that people are trying to get the language right without really changing their attitudes, It's almost like, actually that still sounds patronizing, maybe because that's the underlying attitude is patronizing, So at the end of it all, language keeps kind of trying to catch up in a way, doesn't it? And just
I know, and people go through stages, you see, don't they, of deprejudicing themselves, because it's an unconscious thing and it's embedded and it's hard to get at. It might be that someone is sounding like they're just going through the motions of using a language, but that they are made a step forward anyway. It depends on how they're doing that, whether that is actually something that they're engaged with and believe in, or whether they're just doing it because they're being overheard. That's different, so people, for me, I think people are allowed to be in stages of change.
I completely agree. That's only realistic. Yeah, absolutely. And all of us have areas where we're probably, a bit ignorant and we need to catch up when we get the opportunity. I think that's just a lifetime, piece of work that we need to be open to. I think, be real. One of the more recent ones for me was shifting from non-verbal to non-speaking.
Yeah, I know.
Only in the last couple of years that I would have, simply been educated in that, just simply come across it, and that, just people telling me,
pointing it out. That's it, because these things, you just say them and you haven't necessarily given it any thought, particularly until someone points it out. And then with a moment of reflection and analysis, you think, oh, actually, that's sort of revealing this or that meaning, What, just for the sake of it, what is the difference between the two then?
Well, lots of non-speaking people use words. They just don't speak them. They're not non-verbal, because non-verbal means without words. So, if you could be non-speaking and write, for instance, or communicate through, various forms that use words, but not speak. There's
something else about the way that those two phrases sound as well to me, that the non-verbal suggests that it's on the receiver's perspective, whereas the non-speaking is on the person, that they are not doing the speaking at that time or ever, or whatever we're talking about,
That's a really good point, I think.
Yeah.
And maybe that is actually a central point in proper affirmative, not just language, but attitude. In this case, neuroaffirming, a territory that we're talking about, but also more generally, that that it's affirming if it reflects the fact that you're trying to see it from the other person's perspective. You're trying to see it from the autistic person's perspective, or the otherwise neurodivergent person's perspective. You're trying to see it from the perspective of a disabled person in some way or other. Some or a minority, a member of a minority group, not your group. You're trying to see it from their perspective. And if you're trying to see it from their perspective, that will show in the language.
Yeah, absolutely. Because it's about, as well, isn't it, in some ways revealing to yourself and to others, as you say these things, or as you use certain terms, about how you're conceptualizing the two of you. You might not be knowing that you are doing that, but it's like, am I crediting that person with having the same amount of power as me, or the same amount of self-efficacy as me, or impact as me?
And am I really, in that sense, thinking of them as a full person? I mean, this is the harsh truth that we have to look at. I mean, this still applies with attitudes to women in a lot of the world. The work of feminism isn't done, because it's about seeing, not really bothering to see people as full people with full perspectives of their own that need to be understood, that need to be taken into account, that we need to empathize with. I mean, after all,
to the same degree that you hold yourself in. It's all right saying, oh, yes, I do. Yeah. But we're talking about the comparison. Is there a hierarchy? Is there a difference? Or is there actual equality here of concept?
Yeah. Mm-hmm. Yeah. I mean, it actually reminds me of another example, like the DSM talks about kind of, restricted activities and fixated interests and things like that. And, obviously to call that territory special interest is an improvement. But for a lot of people, it doesn't go nearly far enough, because, again, it reflects, I think, what we've just been talking about, like the I-you thing, where the I is the more privileged, dominant perspective, and the you then is somebody, in a minority group like autistic people. And it's like, I have hobbies and passions and deep, kind of things that I'm deeply engaged in my life. You have special interests.
Yeah.
Just it shows that kind of link, doesn't it, between the language and the perspective. Why do we need some clever name for the passions and of autistic people? We could just say, well, they do tend to be a bit more focused and intense. Other than that, they're still just passions and hobbies and jobs. Different.
The word special, it seems patronizing, doesn't it? It seems like it's sounding on the surface like a compliment, but it's actually an undermining of worths in some way. Yeah.
And I think that's one of the difficulties people have around that, and the whole history of special needs education and that way of thinking, rather than human needs education. But also, I think the word interests is also indicates something. It indicates that people, whoever came up with that term, didn't really ask autistic people, because interest is not a strong enough word. As soon as you ask autistic people, they use words like passions and hyper focus and intensity. They don't just talk about interest,
or even my thing. It's my thing. It's my big thing.
Talk about interest as well, but it's not the most common word that comes up in that area. It's much more passionate sounding, enthusiasm, things like that, you know.
Right, because when you're thinking about being a person who is an autistic person, and that as soon as you know you're going to be getting free time, you're thinking, I can't wait to do my thing. I can't wait to get involved in it. You know, so there's like it's much bigger than just an interest, isn't it? That is underdoing it.
I mean, you know, if you brought that term special interest to somebody who'd never heard of it and you never come across it in the world of, you know, talking about autistic people, and asked them, where do you think this term comes from and where is it used? You know, they might guess at something like, well, you know, perhaps a, you know, a secondary school teacher might have a special interest in one of the, like an English teacher might have a special interest in one of the poets on the course, on the English curriculum. You know what I mean?
Yeah.
You know, something like that. That'd be a kind of a, you know, a specific little pocket interest, you know, that goes beyond the rest of their interest, you know, or, you know, I might be a, you know, you know, be a gardener, but I have a kind of, you know, a special interest, you know, in maybe, you know, trying to grow a particular kind of plant, but not a passion. That's not the same thing as it, you know, you get dive deeply into it and it absorbs you. And when you're in it, you're completely engaged in it. It could just be, oh yeah, I'm interested in that. That's kind of, yeah, a bit more so than some of the other stuff, you know. That's a bit of a speciality of mine. It kind of carries that feel to it.
Yeah.
Which
Whereas a special interest person, an autistic person, would know everything about dahlias.
Exactly. And tell you all about dahlias.
Yeah.
Given a chance, yeah, exactly.
And all the different varieties of them and the colours of them and the times that they flower and all kinds of interesting things and marvellous expertise about that subject.
And do it with a great excitement and enthusiasm and wonder and joy, you know. So again, you know, unless somebody grasps that, you know, it almost doesn't matter in a way what language they use because they're just not getting it, but it generally is reflected in the language, I think. You know, when language is neuroaffirming and people use it really well then usually it means they've taken the time to, well, you know, there was a very interesting phrase used by Kieran Rose at a recent conference in Ireland there back in April, the Awesome conference on autistic people and mental health. And he was saying that, you know, in his opinion, therapists and other professionals don't need to be don't necessarily need to be autistic to work with autistic clients, and in fact that doesn't automatically make them the right person, you know. But he said what they need is to be immersed in autistic culture. Obviously, if you're working more broadly neurodivergent clients, then immersed in neurodivergent culture. So, you know, I thought that was a very good way of putting it, you know, because if you're immersed in autistic culture, you'll have done more than just look at one article that gives you a list of neuroaffirming language and learned that neuroaffirming language off by heart and hope to be using it correctly. You'll be using neuroaffirming language mostly correctly and maybe even taking a chance with some of it because and seeing how it goes, maybe even inventing new things and seeing how they go down with clients you're working with because you're immersed in autistic culture. You know, like being immersed in a foreign culture, you know, you'll know the nuances and you'll have heard so many stories from autistic people and listened to so many autistic people talk about their experiences and you know, engage deeply with so many autistic people, as well as reading so many books and going to so many, you know, workshops and so on. But you'll be deeply immersed, you know. And I do think that, you know, generally affirming language comes out of and sits well in that, not just on its own.
Because then that person would know when they're talking about like special interests that actually what they mean is, oh yeah, I know that David loves dahlias. It's something that really lights him up.
Yeah.
They would know that. They wouldn't need that. They would know that.
Yeah, they would and would refer to it, you know, if talking about it. I mean, you know, some of this terminology is somewhere in the middle in terms of, if you like, acceptability. But, you know, acceptability and affirming aren't the same thing. Like special interests isn't a term that everybody hates. You know what I mean? It's just a questionable term, and I agree it's questionable. It doesn't really capture the real nature of this. However, when I'm giving an initial training in this area to therapists, like when it's their first time getting any training in this area, I would start with that term. I'd say, by the way, we're now going to talk about this area that's known as special interest. Now, that's quite a questionable term, but, and I'll expand on it. But in the meantime, I'll start with that term,
Yeah.
I don't think I'm saying something heretical by using the term and I should wash my mouth out, I just think I just need to show that, there's more to this. We're interrogating language, and we're moving, and we're trying to invent new terminology as we go that better captures and conveys to autistic people that their experience is being better captured, and that you have some sense of their world, not that you just know how to tick the box of neuroaffirming language.
Yeah. And the most obvious one that is the biggie is, of course, the difference between using diagnosis or even self-diagnosis to self-identification. And that if a person is going for an autism assessment, let's say, they might say that that's been validated rather than diagnosed by. And there's a subtle difference there, isn't there?
Yeah. And a word I love in that context, that I use a lot when I'm talking about this with clients, particularly who are in between as regards these decisions. They're not sure whether they're exploring whether they might be autistic and whether they might identify with that, whether that might be helpful, whether they want to, for a formal assessment. I think the word discovery, self-discovery, guided discovery, supported discovery, joint discovery, all that language, I think, captures well what we're talking about. So it's not just like it's an acceptable word or not, it's a useful word. It helps to put across that message that this is about you discovering about yourself. And if you do go for a formal assessment, then you will get what's called a diagnosis, because that's what it's called. They will use the DSM criteria, particularly if you need it for some purpose, like applying for, accommodations in college, then you'll get a diagnosis of autism spectrum disorder, because that's what you'll get, because that's part of what I call the medico-legal model, in other words, it's a legal requirement. But the actual process, we want to talk about that. I mean, lots of people do that and then go for therapy because they still don't know who they are. Well, they've been told that, yes, you come through this assessment and we are diagnosing you with autism spectrum disorder. They still have very, very little of the implications of that, or, well, what does this mean for me? So the whole discovery and identification process still has to happen in a way.
Yeah, definitely. Absolutely. Yeah. And of course, as you're saying, you don't have to have an assessment anyway. You could get those things validated by any way that is right for you, to feel that you've got validation of what you're thinking and exploring. Even with yourself, it doesn't have to be another person, but that's that's it, isn't it? Because if you have a neuroaffirming assessment, which there are private assessment centres that do neuroaffirming assessments, it's a collaborative experience, so you're together figuring out stuff, and they are, using their insights to help guide that exploration to be helpful. Whereas often you think of an autism assessment as being, I'm going to go and be checked to see if I've got it,
tested.
And be tested by the other person and marked, like going on a driving test, going to be assessed in that way.
Collaborative identification process or things like that in the language now that some of those private, clinics would use when they're
and some of those, when you go through those things, some of those centres and some of the experiences that I've spoken to people about that have been through them, they do learn things about themselves, because obviously, as you do when you're chatting about yourself and you're exploring your life and your experiences and you're articulating things and reflecting on things together and making meaning and so on, But even then, it's the tip of the iceberg, isn't it? Because you still there's still a question of not only, well, what now, but also, well, what was all that then? What was all my life? What meanings do I make of everything? What's the implications and the relevance and the explanations that I thought I had before? Have they got to be changed or looked at or thought through differently? So
yeah. So, it's a deep, complex self-discovery process.
Yeah.
And therefore, a self-revealing process, and therefore kind of a self-unmasking process, as we would say. And therefore, again, requires a very validating context in which to do that. It doesn't have to be a therapist, but it can be, a lot of it can be just with other autistic people that you meet on or offline or whatever context, just gradually feeling safe to explore who you really are. I mean, I think it brings me to the other bit that I wanted to mention, which was that, of course, very, very powerful neuro-affirming, neuro-validating language is some of the language that isn't so much replacing old language, it's just language that's been invented in the autism community, and masking is one of those words that's been invented. Again, it's an easy word to throw around and not quite understand. So, using it is one thing, having a sufficient immersion in the autistic culture that you actually have a sense of what masking and unmasking might mean is another matter. I mean, we've just talked about it there for a minute, but again, lots of people know the word. Lots of non-autistic people are people who aren't familiar with the realities of being autistic, but have come across that term. Sometimes kind of think they know what it means, but there's a lot to it.
There is a lot to it. It's an extremely complex concept, isn't it? And everything. And that actually, when we're thinking about using language, even if you use the correct word, of masking, there might be an assumption behind that that might come out in the way that you use that. So in other words, you might say, oh, well, now you're autistic, then you can start unmasking when you go to work, like as if it's so that's assuming that the person is actually doing something. They're putting something on to create a false self, when actually that's definitely not the description of what masking is. It's much more complex, and it's an interplay, isn't it, between expectations and survival in the autistic person that creates this option to hide from threat and be protected, and it's unconscious or it's consciously done. It's not a behavior that you just choose to stop doing.
No.
And that, or the responsibility for that, is on the autistic person. Environments need to be safe for a start, for the autistic person to be able to emerge from a self-protective shield.
Yeah. Or another thing that people sometimes say that reveals lack of a real grasp of what we're trying to convey when we talk about masking in this context is they say things like, well, should we all mask? All human beings mask, which is true, but it misses the point. It misses the point of the particularity of this particular experience of a minority group at this particular point in history, which is a lot of what is often the problem with all of this language stuff, is that it's being used. Neuroaffirming language is partly invented to try and explain our experience to the majority, and then it sort of even gets co-opted sometimes, and we have to come up with some other new word.
Yeah, and then there's two words that are quite strong words. I wonder what you think of them: burnout and meltdown.
Yes, I was thinking about those words as well, because I think burnout, meltdown, shutdown, and also stimming, they're the ones I also had in mind. Again, it's terminology that's been invented in the case of stimming to try and replace stereotyped motor movements, which is the worst thing of all in the DSM criteria. to explain, to try and grasp something that, again, people need to put a lot of effort into understanding the meaning and value and experience of stimming and varieties of stimming and varieties of functions of stimming. For autistic people, maybe a topic for us to come back to. But similarly, to talk about, meltdown, shutdown, burnout, autistic burnout specifically is an attempt to try and say we're talking about something here that has similarities to what non-autistic people experience, but there's also something different in our experience, particularly at this point in time, while we're trying to understand it ourselves and convey it to the world and get help with it, and it can easily be just, dismissed. But no, I think they're very, very important parts of, again, using neuroaffirming language would be to use those words correctly with people and accurately and with careful listening.
Although, you see, we do use the words meltdown, burnout in particular. I don't have a problem with shutdown, but meltdown and burnout, I struggle with those words. I mean, meltdown in particular, it just doesn't, but we all use them, like we in exchange with each other. Autistic people use it for shorthand, don't we, for something? It describes something, so we know what we mean when we're saying that to each other. But when you stop and think about it, they're not great words, are they?
Well, they're not great words in the sense that they're negative, but then they describe a negative experience. So whether they're not great words in terms of capturing, at least initially in one word, what we're talking about, I think a lot of autistic people would think that meltdown is a useful word in that way, as in they'd say, oh, that's a good way of describing it. I mean, it depends on what the list underneath the word meltdown is, obviously, and the same with burnout. I mean, burnout anyway, I think is in many ways isn't different from general burnout. It's more the causes are different. Some of the outcomes are different, but a lot of the difference for autistic burnout is just the causality, is the experience of having minority stress. So that's not the usual cause in the majority. Yeah. But yeah, see, this is part of the difficulty, is that in the history of language in relation to minorities and marginalized groups, terms tend to take on negative connotations anyway, and then sometimes have to be dropped and you have to move on from them. So the meaning, the denotation, as they say, of a word, the kind of meaning that it's intended to have and the connotations it picks up and has in different people's minds are separate things. And yeah, I think that's why some people don't like special interest and some people do. And same, like I don't particularly mind the term meltdown, but obviously that's one that, you don't like the feel of. Yeah.
No, I think it twangs of tantrum to me. And that's obviously a personal thing for me, that I can't distinguish the two. So they sound, it sounds blamey and mocking, to use a word, but it might not feel like that for other people to use that too.
Language is a funny old thing,
Yeah.
The thing I've been exploring a lot in recent years, just philosophically, and partly because I'm just interested in it, just find language fascinating, but partly because it's got so much relevance to this kind of area, like even on a slightly different tack, or something we could come back to sometime, it's even like, what sort of a thing is autism, and what do we mean by that word? And being autistic is a word that points towards some definite thing that definitely exists, or is it a word we use to try and put some structure on a phenomenon that's actually a bit messy and doesn't have neat edges and, is useful for us to categorize? I mean, the second is the more modern view in terms of social constructivism and philosophy of language and so on. So, but the same with all the language we've just been talking about today, the neuroaffirming language, like words don't stay stable or neat, they can start out with positive connotations and take on negative connotations. I mean, obviously people started using the word gay because it's a word with positive connotations. Of course, in many people's minds, taken on negative connotations, and the history of, intellectual disability, goes all the way back through mental handicap, back to mental retardation, back to moron and idiot, and the continual change in terminology as the terms gathered negative connotations. So it's strange territory in human life,
I know, because if you think about the 50s and 60s, there were those terms, weren't they, like infantile autism, or do you know much about the hyperkinetic disease? How about that one?
I've heard the term, but I can't place what it's about.
Yeah.
Okay. Yeah. Yeah. So look, lots there. Probably probably about enough for today.
Yeah.
And yeah, it might lead us in a few other directions. I suppose all these things do just stir up other pieces. Yeah, yeah. I'm kind of curious at the moment around that question of, like, when we say, we're becoming more aware of autism or of the prevalence of autistic people,
Yeah.
I think it's going to become more and more of a challenge, and I mean a proper challenge that should be a challenge for us to get really clear what we mean by that. I think over the next while, I think now that it's becoming in a way accepted, we have to look at this. But then if we don't mean a disorder and we don't mean the DSM definition, then yeah, what are we saying? Are we saying it's something that some people would think, well, it's a genetic thing. So if we just find what genes you have, you're autistic. It doesn't really matter what your experience is. You know what I mean? Like, you've got the autistic genes, so you're autistic, Actually, even from a geneticist's point of view, it's not that neat. There's no neat genotype that they're likely to find. Similarly, but like, if we just do it, we'll find a certain type of brain scan you can do, and then you're autistic. I don't feel autistic. Yeah, but you've got the brain pattern. It's like a lot of people do think of it as something as neat and definite as that.
I see, yes.
Wants it to be, and yet I don't think it is. I think it's a quite complex set of overlapping things, which some people would say overlaps even with ADHD, and then maybe we need to see them as the one big spectrum. So how do we categorize how do we know what we're looking at? Or is it do we group things for convenience? Raises huge questions around things like the DSM categories anyway. I find that area just rather interesting at the moment. So maybe we might talk about some of that. Yeah.
And of course, they change over time.
They change over time anyway.
Categories of convenience, isn't it? What we know at any one time in history, and the best ways that we can sort of think of to talk about them. Yeah. Because I mean, there's over 100 genes involved in autism, and I think the modern thinking these days, I think is that the thinking is that it's the autisms, isn't it? And that there's 4 main phenotypes. That's what the thinking is at the moment.
At the moment, you see, I'm also a big fan of that. I think that it'd be dangerous to think all that thinking was wrong in the past, but now we have it. We don't. That's not how it works. We will be looking back in another 10 years and thinking, why did we say that? Why did we think that?
Such a narrow view. Yeah.
Let's just keep going and thinking we don't really know. There's lots we don't know. That is much more realistic and more interesting,
Yeah.